So this evening we're going to be talking about under pressure, midwifery wellbeing. It is a time when we are under pressure as midwives and as midwifery students and as all of the people within the maternity services, and we felt that we needed to give some time to just supporting and giving some information to our colleagues. So this is the Midwifery Hour. Like the clock, we're going to try and keep into 1 hour. The aim of the session is to provide you with information and support to all of you, and it's all coming through quite well. We're on the Twitter. Any of you Twitterers, you can tweet hashtag Midwifery Hour, and the Twitter account is Midwifery Forum. Okay, now I think it's hard for us to remember, but at the beginning of the year, and it's not very long ago, we were full of excitement and full of happiness. It was the year of the nurse and the midwife, 2020, and it was very celebratory. We were very happy. We wanted to do our best and celebrate being midwives and nurses. But then suddenly came the coronavirus, the COVID-19. Having said that, I'm going to flick back. It's still the year of the nurse and the midwife, and I think what's happening over the last few weeks is nurses and midwives have really shown they can step up to the plate. They can do a huge amount to support parents, patients, families, whatever. I wanted to celebrate still. I think it's still worthy of celebration. It's a shame this looks such a pretty picture, but it's such a horrible virus. So the coronavirus, COVID-19, it's now designated as a pandemic. I know all of you will know about this, and all of you will know how it's impacting on your normal life. So people with any health issues are being shielded for 12 weeks. Everybody else is on lockdown for 3 weeks and staying at home, with the exceptions of if they're in a key job, they're allowed to go out to work. You're allowed some exercise during the day, and you're allowed to go out and get some food and your exercise. In the health service, and I think it's at this point I'd like to pay a tribute to the three nurses that have died. I think this is a very sad day. We've lost 3 nurses, and one was Arima Nasreem and Amy O'Rourke and Thomas Harvey, and I'd like to pay tribute to them and just remember them for a moment, and then their families and friends. It's a very hard time for them, as well as the 4 doctors who we've also lost recently. Otherwise, many of our health service colleagues are in self-isolation because of family members or themselves being exposed to infection. There have been huge anxieties about personal protective equipment, PPE. We're getting used to a whole new language now as midwives. We know testing has been very limited, and quite a small number of NHS staff have been tested. It was 2,000 yesterday. It might be a few more today. What has been happening is the NHS has been rising magnificently to the challenge and opening up conference centres, stadiums, units, using them for intensive care facilities and care facilities for COVID-19 patients in all the centres in the main cities across the UK. And that's magnificent. Of course, the impact on staff wellbeing is that people are working longer hours, they're having to change their patterns of work, they're having worries about PPE, and they're worrying about their families as well as themselves. I think, especially being midwives, I think it's more common for us to worry about other people before ourselves, which is part of the purpose of tonight. And of course, the impact on maternity specifically is there is sickness amongst midwives and other maternity staff. There are limited activities going on within maternity. Women are being encouraged to seek other ways of getting their antenatal care and postnatal care rather than coming into the hospital or attending clinics. Some services are limiting visitors. There has been some talk about midwifery-led units closing, and some question about using home birth facilities because of the difficulty of transferring women to the acute unit should they need care. And obviously, the huge thing is the anxiety in women and worry for women, families. I'm not sure the babies have the anxiety and worry, but I guess they might pick up from their mums when they're concerned. And of course, again, anxiety and worry for midwives and student midwives also. Now, I did find these new PPE guidelines, and these are the midwifery-specific guidelines. These came out yesterday. It's worth reading the document, and we've got that in the resources page. And I found this, it's like learning a new language. And I'm sure people who are working with this day in, day out are getting very used to it, but it is another language. And sometimes when you're very busy, it's even easier to use a nice, simple table to see what you should be wearing. And this clarifies for staff how they keep themselves safe, because at the end of the day, we have to keep ourselves safe in order to provide care to mothers and babies. Just a word about birth partners, because I think this has been in the news recently. We know that having a trusted birth partner present during labour really makes a big difference to women, to the safety and their well-being. And at this point, people are getting concerned about it. This statement came from the RCOG and the RCM to really reiterate how important it is for women to have that support, and the fact that women might need to have their antenatal care without their partner present, but they should have their partner present during labour. However, if their partner has any sign of infection, then that partner needs to stay at home and isolate. And therefore, one of the important things is to advise women to have a backup plan and a backup birth partner to support them at that time. Okay. Again, students have been talked a lot about in the press, and some of them will be coming into practice and will need to be looked after and supervised, because even though they're working in the clinical area, they must be supervised. And there's various NMC regulations and discussion about this going on. So if you have any queries, just check the Nursing and Midwifery Council updates. And also, this is what the guidelines are. So in year one, generally the students stay carrying on their studies. Year two, they may work in the clinical area and have less theory. And in the third year, the final 6 months of their last year, they have an option to move into clinical practice. And I'm aware a lot of students have taken that option and really want to help their midwifery colleagues, but also help and support women and their babies. These sort of recommendations that have been made by Health Education England, I think, cover midwives as well as students, having regular breaks, knowing where to go to get local support. And many, many trusts are setting up fantastic support systems for mental and physical support of midwives and students, having things like a wobble room, so people can go and just have some time out. If they need to have a cry, there's tissues. If they need to have a cup of tea, there's a cup of tea. It's really important, these physical things. And also making sure students have a safe induction into the new area, which we tend to do anyway, and be supported to raise any concerns they might have in that area. Really important. Okay. Had some thoughts about the midwife survival toolbox. I think my two colleagues are going to give you more than enough for your massive toolbox. But I think one of the most important things is we must be up to date with the information. The trouble with that is you get overwhelmed with it. If you're listening to the news, if you're looking at Twitter, and if you're talking COVID with your colleagues all the time, it can get very overwhelming. And again, I know Jenny and Sheena are going to give you some extra tools to cope with that. But making sure you've got NMC guidance at your fingertips, looking at the information from the RCM and the RCOG and Department of Health. They keep on putting out some fantastic information, and it's really useful to to have access to that. Also, there's a good series of seminars on COVID-19 from the Royal Society of Medicine. There's also the Practising Midwife and All for Maternity Nurture Zone, which is a fabulous space to get information and support so you can look after yourself. Additionally, you need access to PPE, and I know over the last couple of days, especially from listening to the Health Minister, this is being sorted out, and it's a matter of logistics, getting equipment to the right place. And if you haven't got equipment, you need to make sure it's being reported to ASAP. Sorry, as soon as possible, using my slang. I've got the wobble rooms, having a quiet room, just somewhere you've got time out, and remembering it's okay not to be okay. This is out of the ordinary. This is unusual. This is really heavy duty stuff for all of us to cope with. At the end of it, we need to look after our nutrition. The difficulty when you're stressed is the thing you want is all the carbohydrates, the chocolate, the biscuits, and of course people are giving you things like that to keep you going. We'll have to think about losing weight later, I think, but keeping some exercise can be tremendously important. Having a strategy and maybe looking at coping calendar, taking each day as you can. Okay, now I'm just going to come to a little end there because I know you'll want to listen now to the two speakers, and I'm delighted Jenny Clarke's joined us.